Hi, this is Dr. Donald Pelto. I want to go over a little presentation about how to attract new patients from the internet. And I am a foot doctor and a podiatrist, but something that I find a lot of people have been coming to ask me about, and other doctors are certainly interested in, is how you can use your own practice and what you do on an everyday basis to increase more patients into your office. The main key is patients need to identify with you, and there's a lot of different ways they can do that, and I want to go over a few of them with you. But the main thing, I think it's important for us to look back. So if you look back 3 months from now, if we were meeting here today and you were to look back over those 3 months, what has to happen during that period in your office for you to feel happy about your progress, about getting more patients from the internet? What needs to happen? Do you want one more patient? Do you want 3? Do you want 50? We have to kind of look back and see what's a progress to you, because it's not something that happens very, very quick. As we all know, there's no quick answers and there's no quick money, but it's a process that takes time for you, and we're going to kind of look into that. So what's the big problem? The big problem I find is that more and more patients are going online to look for their medical information and to find their doctors. Many people in my profession with dealing with feet and foot problems, they go online to search how to treat plantar fasciitis or heel pain, how to treat their own ingrown toenail, and there's tons of videos and there's tons of resources online to help them. But when it comes down to the actual treatment, many people still don't feel comfortable treating themselves. They may try some initial treatments. For example, with heel pain, they may try icing the area, doing some stretches, taking some anti-inflammatories, but when they can't get better, then they tend to seek out the doctor. And the doctor they tend to seek out is the one that has the most information online or the one that's referred to them. There is a large learning curve. That's why some other people aren't interested in doing this type of marketing, this way of growing your practice. It takes a little bit to get going. And others say to me, well, I want to appear professional, and I really don't need to do it. I'm busy enough the way it is. I want to be a professional doctor, and just because you use the internet and use different types of means to market yourself doesn't need to make it unprofessional. There are ways of doing it professionally, and really what you're doing is you're providing patients with information, and if they receive enough good information from you that's valuable, they tend to seek you out to be their doctor. So what if you could attract more patients that you want, the exact type of diagnosis that you want? What if you could automate this process by using your current staff to help you? What if you could use your current knowledge that you have to help more patients and get more patients? And then what if you could automate the follow-up with your patients? The whole key here is what we term leverage, because as any type of a doctor or healthcare professional, if you're in a clinic, work for a clinic, you can only see so many patients a day. I know some doctors, they pride themselves. I've seen 30 or 40 or 50 patients a day. Others say, I don't want to see any more than 20. There's different doctors' approaches, and it's not really by seeing more patients that's going to offer you all the results, because you can use a lot of automated means to kind of replicate yourself. Just think about it. Are there certain things that you tell patients, certain conditions that you explain over and over and over again? And maybe would it be beneficial for you to make a little video or an audio explaining that thing, that condition, and then sending it to the patient or giving it to the patient either before the visit or after the visit to kind of reinforce it? It saves you a lot of time, and it also it's kind of an extension of yourself. It's using a technology instead of using another staff member. Quick story, for example, when I do foot surgery, I give my patients a gift afterwards. And in this gift, it has a little bottle of water, some little treats in there. But most importantly, the reason I give them the gift isn't the gift itself. They like the gift. But most importantly, what I have is a post-operative message. And what this post-operative message offers is a message saying, well, if you're listening to this, thank you, I hope you feel better. And what are the 5 most common complications that people have after surgery and what they should do about it. For example, I remind them to keep their foot up and elevated. I remind them to keep icing the area. I remind them all these things that they need to know after surgery, so that ultimately I get less phone calls. That's the reason I do it, but I do it in the effect of a recorded message that I put online. Okay, so that's kind of what I do. Another concern that some people have about this technique is that they don't want to teach anything, because if they teach using the internet or using a blog, someone won't come to see them. Well, the way I like to think about it is that teaching, whether you're teaching a patient through a live lecture or via the internet or even one-on-one in the treatment room, it's really setting you aside as an expert. And that's what the patients want. They want to know that you are the expert, that your office is the expert. And if you think about it, they're going to go to see the expert, the one that has the most information, whether it be if you've written your own book or you've made your own video. Some reason they want to expect and they think that you're going to be the expert and they want to go to that person. I kind of equate it to a musical band. If you put the worst song on the radio, no one's going to buy the whole CD or download the whole MP3. What they usually do is they put the best song on. And the reason they do that is because by putting the best song on, everyone's going to want to watch the other stuff. So I tend to say put your best secrets, your best tips for the patients online, and that'll cause them to come and see you. As I mentioned before, you can use these educational materials to educate your patient in advance, to save time in the treatment room about certain conditions. So if you, for example, see a lot of people with diabetes, there's a way that you could educate them in advance, giving them information, sending them emails, PDFs, videos, audio files, and really have them listen to that prior, maybe even making it a requirement for them to read that or listen to that prior to coming to see you. And ultimately, everyone's going online to find more and more information. And if they find information, it really should be about you and about your office. That's what it comes down to. So let me give you an example of how you can set yourself up as an expert. This is just what I do. You don't have to do it this way, but if you see here, this is an example of my videos from YouTube, and it has proper treatment of ingrown toenails, toenail injuries and treatment, patient experience. This is a live patient testimonial, how to treat a Haglund's deformity. This is a video I did on fungal toenails, but in Portuguese for that market, how to remove a toenail, how to do a comprehensive diabetic foot exam. This is a presentation that I gave about podiatric medicine, and then as well another one on ingrown. You can see what people are interested in. This has 15,000 views, how to remove an ingrown toenail. These ones here about a Haglund's has 120 views. So these were only up there for a month, and it has 120 views. So as people see it, and as it's up there longer, you're going to have more views. It's a way to set yourself apart as an expert, and it's very easy to do. We're going to show a portion of this today. This is an example of educating people in advance. This is an actual video that I put together on YouTube where I actually go through exactly how to do a comprehensive diabetic foot exam. This is a foot exam that everyone should have, and many times a primary care or endocrinologist will do it, but I want to show the patients exactly the steps and the forms that are used. Not that they're going to do this on their own. This isn't to substitute my care, but it's just explaining and setting me apart as an expert, because you're not going to go into all the different complications. I just did this exam on a normal patient without any complications. And then this is an example of how you can follow up with patients. As I was explaining, if you use this is a kind of a weekly newsletter that I use. It populates with a title that you can put on. These are the contents, and this is a way to learn more. So what happens for my blog, we'll go into more detail later, but I put a blog together every week. I actually have a staff do it. And from blog posts, it actually adds the contents to this newsletter automatically. So they'll get the newsletter with my current blog information, so they can click on this. This will come to their email every Monday morning. And then down here, I have ways that they can learn more. If they're interested and they found this helpful, they want to learn more, they can go to the website, my YouTube videos, or different lectures. So it's a way to kind of stay in front of the patients. And this isn't going to be something that you need to learn everything and start all completely over, because you probably are already doing some of this. You already have some knowledge or are already using some of these. For example, many of you may have had a podcast or done a podcast, or many of you, or pretty much everyone, has a website. You can currently use your website to do this. Some people have a blog, and if you don't, a blog can be added to a website with very, very little work, and it's something easily you can add. You may have heard of SlideShare. SlideShare is a way that you can actually put a presentation such as this up online with words. We can record audio behind it, or you can as well Just put up the slides there. It sets you apart as an expert. You can send links to that. You can use email, or you can use something called Constant Contact. This is a way of connecting to your clients automatically, so it sends out a newsletter this way. You can also use MailChimp, another one. These are newsletters. You can use regular paper newsletters or digital newsletters. Both of them work excellent, and a combination of both is very good. You can use YouTube. YouTube it has videos. These are very easy to make, especially with new phones. You can make them right on your phone and upload them. You can use something called an autoresponder. This is a really powerful tool that's easy to use. I'll kind of give an example of how I use it. I have a lot of patients that come in, they're referred over from an endocrinologist or a primary care doctor for a condition of diabetes. When I see them, I actually have a series of 10 emails. They're for diabetics, and they're spread out about a week apart. And so when I get their email, I put it in there, and it sends them an introductory email and then an email every week covering a different topic about diabetes in their feet. Because what I find, and what you probably find with patients, is that they can't absorb a lot of information. Maybe even how much I've went over right now is too much. But if you spread it out and give little pieces of it on a weekly basis, they're apt to learn more. And if you can continue to review things, that's where these autoresponders are so important. So pretty much what you do is you line up some pre-made emails, and you put them and you save them, and then it sends them out at the certain designated time. Works very well. Pretty much everyone has Facebook. Facebook you can integrate with this as well. Twitter and LinkedIn and Google+. All of these you may or may not be using. So I want to go over two parts today. That was just kind of the introduction. The first part is called a hub and spoke process. It's kind of the way that you can kind of spread out all your information very easily using the information that you currently have. And the next one is the list building process. Those are the two parts that I want to cover in this little talk. Certainly, if you have any questions, you can chime in or email me. But we're going to start with these two things. If we cover these well, that's the goal, and then we can go deeper into any of the individual topics later on. So let's start with the hub and spoke process. So the hub and spoke process is kind of based on a wheel, and in the wheel you have the hub, and then you have the spokes all around it. And as you can see here, what I consider the hub, or the main information that you're providing, is your blog, and the spokes are these other media that we talked about. And everyone says, well, I can't do everything well. They get overwhelmed because you have all these things that we just talked about. You have YouTube, Facebook, Twitter, LinkedIn, SlideShare. What should you do well? Well, learn one that you can do very well, and then syndicate it to use the content on the other mediums. This is one of the best keys that I ever learned. So if you're going to do something well, if you're doing your Facebook well, just do that one well and then share all that information other places. If you're doing LinkedIn well, do that well. If you're doing your newsletter well. What I found, what tends to work easiest for me, is doing a blog well. And what is a blog? All a blog is adding new content to your website on a weekly basis. So I add a blog article. It can be any number of words with a topic and a picture. Many times I use a video. And that centralized information I send automatically to the other sources. That's what syndication means. So how often should I blog is the big question. Well, I recommend blogging at least once a week. If you have time, you can blog more often. And I'll actually explain how you can have other people blog for you as well, so you don't have to do it yourself, or you can use the current tools that you're doing. So let me show you. I'm using Blogger currently. Very easy. You can get a free account, or you can get one with a custom domain. What you see here are the views on my blog, up to 50. Page views today were 100. All-time views were 40,000. This shows down here where most of the people are looking at it from, mostly the United States and Alaska. It shows where they're coming from, and the posts that have a lot of views on them. So basically blog once a day, and I want to explain how you can do that. Okay, I don't know what to blog about. This is a big question and a big concern that I get from a lot of people. Now, I want you to know that if you're a doctor, you can do the blogs yourself. If you're an office manager, you can do the blogs. If you're an assistant, you can do the blogs. It doesn't really matter, but you have to blog about something that's interesting to the patients. And Preferably, a staff member works better, okay, than the doctor themselves. Why? Because a doctor, unless they're able, it tends to use doctor language. They make it very complicated. They only know big words. When you're doing a blog, you have to kind of dumb it down to about a 6th grade level. So you make it very simple for everyone to understand, because you don't know the age level that's going to be getting your information or searching for your information online. Here's some tips for what to blog about. Use questions you currently get from your patients. Every single day in your office, you're getting patients asking you questions. For example, what causes heel pain? Why should I get orthotics? How did I get this ingrown toenail? Why do I have diabetes? What's the hemoglobin A1C? All of these questions that relate to your profession are good topics. Okay, so also use the questions that your staff currently get. What do I do if my dressing gets wet? Can I walk on my foot? How do I know if my toe is infected? What type of socks should I buy? What type of shoes should I buy? What do you recommend for a lotion? These are just questions that I get. Now, these may seem like very simple questions, but these are questions that people are Googling. They're putting it online because they're questions that they get. So if one patient is asking a question, probably hundreds of patients have the same question, and most people are looking for answers. You can also, if you want, look at questions that are on other websites about your area. For example, you can go look on a diabetes website and see what questions people are asking on the frequently asked questions, or you can go to a wound website, and whatever your specialty is, you can look at that. You can take pictures of interesting diagnosis. Okay, if you have pictures. For example, I might take a picture after a surgery. If someone has swelling, if someone has a soft tissue mass or a wart or an ingrown toenail, all of these things I take pictures of. Why? Well, because it's interesting for the patients, but a video or a picture is very, very important. So you can do pictures. I actually think video is more impressive, and you can take a simple video. And nowadays with a smartphone, you can take out the phone, do a slight video, and ask the patient, how was your experience with your surgery? How was your experience at the office? What did you like? If you have a patient that's very, very happy, get that on video. And then you also get the consent. That's very, very important. Getting a consent. We have a consent form, and I just write on, as the patient's leaving, I say, please get consent. And they fill out the consent form prior to leaving the office. And then sometimes I put in some personal interest items. For example, if I traveled somewhere, if I got new shoes, if I want to share something about my family. And I put one on the other day about a hedgehog video that someone passed on to me, how a hedgehog washes its feet. And you know what? That got more views than all of the other ones that I'm putting about actual diagnoses. So people like interesting stuff. They like fun stuff. If you want to, in this presentation, I actually included a form. And you can click this button to get to this form. I'll actually include the link to this video and to this form if you want. You just kind of click it. It opens up another website that you can go there and answer these questions in there. Okay. So that's the form that you can fill out by clicking there. The other question I get from people is that, well, I don't have time to blog. And every doctor is very busy. That's why I said you can use staff, learning to delegate to them. So some ways you can do the blog. You can write a blog once a week. You can dictate and have it transcribed, or you can pay someone to write it for you. This is a copy of my iPhone, and this is what I use for my blogs. This is the Blogger app where I can upload and update my blog right on my phone. I also have a WordPress blog. This is iDash. This is actually where I look at how my blogs are doing, how many views. Stitch is actually where I can edit the videos. So if I take a picture, I can edit it, add pictures, add lines, add colors to it. This is iMovie. This is where I can actually make a video and add an intro and a conclusion to the video very easily on my phone, and then upload it directly to YouTube. And this is Alphonic. This is how I do my podcast, where you can add in beginning music and after music. It's very easy. So those are really the three ways to do it. I actually started by writing my own, but then I realized I wasn't the best writer, and I found it much easier for me to dictate it and have it transcribed. And I'll explain my process here. If you want to pay someone, you can many times find a medical student or even a staff member to write it for you. But for a lot of us that are just doctors doing this, the easiest way is to dictate it. Dictation ends up being about $1 a minute. So you can talk pretty fast, and it ends to be pretty reasonable. And many of us are already used to dictating. So let's kind of explain the workflow for this hub and spoke method. So doing the blog and then transferring it other places. So the first, what you do first is you write topics and ideas. You can do this on a piece of paper. I tend to use my iPhone, and I save it as a draft. So what I do is I open up the Blogger app, and then I have different posts. See all these posts right here? And they're in draft mode. So as I get a good idea, I'll take out my phone and I'll write the title right here, and I'll save it as a draft. If I'm taking a picture, I'll take a picture and upload it, and then save it as a draft with a title. Okay. Once I get a number of these, I then dictate the actual content of it. A good rule of thumb is if you want to be ranked number 1 on Google in your area, do 10 blog topics, 10 blogs on every topic that you want to rank number 1. For example, in the Worcester area, I wasn't ranking very high for bunions or bunion surgery, so I took pretty much the 10 most common questions I got about bunions. Why does my bunion hurt? What type of shoes should I wear if I have bunion? What type of bunion surgeries are there? And I did about 10 blog topics and on that one area, and now I rank pretty high, maybe not number 1 all the time, but I rank fairly high because I put all that content out there on that one topic. So the way to be an expert in one area is to blog about one specific topic, as well putting the proper tags on the blogs as well. This is an example of the iPhone, and this is an example of my actual screen. And you can see here the amount of drafts I have in here are 135. So what I do is I take about 30 at a time and I'll dictate them. So to do about 30 blogs, it takes me about 45 minutes, so about a minute or 2 per blog. So it's about $1 or $2 per blog to dictate it if I have someone transcribe it. So it works very well. So that's what I do. I use this dictation. I use this app called Dropbox. I dictate it in easy language. That's the key when you dictate it. So I just click this button, and then I go through. I click the button, and then I go through each one of these topics, and I read the title, and then I talk about it. So for example, be careful of what you step on if you're diabetic. And then I would say, what I want to talk about today is people with diabetes, they tend to step on things and not know it. This is a condition called neuropathy. And as a diabetic, you're more at risk to step on something if you have neuropathy. So my tip to you today is to wear diabetic shoes. Don't wear nothing on your feet, and also check your feet daily. If you can't see the bottom, use a mirror. And then I may put a picture on there with someone stepping on something or a mirror. And that's the blog. It might be about a paragraph long. And I dictate it. Once I finish it, I hit the button again, and then it uploads it to Dropbox. Now I usually do a series of about 30 of them at a time. And once they upload here, I click this little button, and then I email it to my transcriptionist. Okay, so my transcriptionist, her name is Lynn Dalbeck. She's the president of a medical transcription service. Here's her email if you want it. I just email it to her, and I say, hi, here's a link to my Dropbox, my reply, and she says, hi Don, I typed all the blogs in a Word document attached. Please let me know if this is what you're looking for or not. And then here are my blogs right here in this document. One thing you have to realize, blogging is different than actually transcribing for medical documents. For medical documents, you want them to transcribe exactly what you're doing on your dictation. For a blog, what I recommend is actually having them authorized to correct the grammar and make it sound better. So she actually edits my grammar. So as you can see here, here are some transcribed blogs. How do I keep pressure off my heel wound in bed? What are the best cleats for my child to play sports in? What is the recovery like after bunion surgery? How can I tell if I have ingrown toenails? These are four blogs. You can see there are a few sentences each. They're not too much, but she transcribes them and she actually edits them for me. Works very, very well. When I used to write them, I tend to be a perfectionist, and it took me much longer than what it should have been taking, and I got bogged down in that. So once they're transcribed, you review them, and then I add pictures and tags. Okay, so I have an assistant actually that do this. So my time it takes is to get the topics, and I transcribe them and I email them. Once they're emailed back, then my assistant takes care of everything else. since my title right here matches my blog title, my assistant goes in, finds the blog title, pastes in the words, finds a picture that goes with it, because pictures are always more interesting, and puts a few labels on it. And I've taught my assistant what to put on there. These labels are what your internet searches for to find. And there's one on podiatry, Central Mass Podiatry, my name, shoes, or whatever the topic is. And then they will they will either publish it right away, or they're going to set a date when they want it to publish. So I don't put out all the information right now, but this person can work in a stint of time putting them all up there with pictures, and then you can schedule it like every Monday there's one's going to go out, or every other day one's going to go out, depending on how much information you have to put out there. So this is what the final blog looks like. How do I keep pressure off the heel wound in bed? And here's a picture of a heel wound, and here's the content that was put up there. Now, the next step is step 7. This is how you syndicate your blog. I'm not going to go into too much detail, but suffice it to say there's a couple of programs. There's many more than this. The two that are most common are Hootsuite and Deliveroo. So what happens is your blog is sent to LinkedIn, Facebook, and Google+. How it works, as you see in my Dr. Pelto's blog, I actually put in the website for it, and it sends it, routes it to LinkedIn, it routes it to Facebook, and this is my other one on foot wound healing, and it routes it to LinkedIn. My Google Plus actually is through the blog itself. It sends it to it. So this is how I send my things other places, and it does it automatically. This is a free service. If you do a lot of them, I think they charge you a little bit more, but really it makes it so much easier to automatically syndicate it. You can use one of these two or find one of your own that you like to do. It's very easy to set up. So that kind of wraps up part 1, which is the hub and spoke process. My thoughts, my ideas to you, if you have a pen and paper, kind of write down what your 3 biggest insights are, what you learned, maybe using a blog or syndicating or something like that. What's the most important communication? Because as busy professionals, whether you're an office manager or one of the doctors, you need to communicate this to someone else. Maybe it's your office manager, maybe it's another assistant, maybe it's just having a meeting with the doctor or the staff to kind of develop a workflow. And then develop your first action. What is your first action? Is it to download the app? Is it to start saving a list of topics? Is it to dictate? If you have a dictaphone, you can do it that way as well, and just start right away. Very, very easy to do. Okay. So now we'll go on to part 2. This is the list building process. So what is a list? A list in this day and age, the list is actually the most valuable piece of information that you have in your office. The list is a list of all your customers and all of your customers that give you permission to communicate with them. Okay, so a lot of times you have a huge list of patients in your office, but you don't have a permission to communicate with all of them via internet or via email, or not all of them have email. So you have to build the list up. And so that's what we're going to explain here. Here's a few of the lists I have: preventing falls and foot problems, diabetes information, foot book, heal my foot wound fast, different types of lists. The main ones I use are diabetes information and foot book, and I've been using them for a couple of years, and I've been building them up as I see patients in the office. So I'll kind of explain what happens. This is what I use. It's called MailChimp, the process. So let's go and look at this last step here. So the list building process. The whole key here is getting people's email. The way we do it is by offering something of value to your patients in exchange for their email, such as a newsletter, a book, video, or an interview. And then you send out that free item and start an RSS-driven newsletter. So what RSS stands for is Real Simple Syndication, where you take your content from your blog, put it into an e-newsletter, and send it out like I showed previously. I like MailChimp because it's free for up to 500 names, and doing this RSS thing is very, very easy. Now, the autoresponder, where you actually set up emails on a certain topic and have them sent out, they charge you a little bit more for that, but just doing this simple thing where they pull it off your blog, make it into a beautiful newsletter that you set up, and send it off is very easy. A couple of the more common ones are MailChimp, Aweber, or Constant Contact. They all can do that for you. So how do you build the list? You have to have a great offer. So my offer on my website, I have 2 things. I have a diabetes toolkit, and then I have a foot pain toolkit. I give them great value. On here, there's a lot of information that my patients can access on diabetes basics, weight loss, medications, wounds, things like that. And I send it up as an RSS or an autoresponder. Usually the RSS is the easier one that we talked about. Once again, they kind of sign up, they go onto my list, and then I use that to develop an RSS list. And this kind of explains on this video right here. If you click it, this link, it'll explain how to send up an RSS e-newsletter. It's really easy. They have a video that explains it. I'm not going to explain everything about it. So I put this title in here. This is what it pulls directly from my blog, and it puts the contents in there, and these are the ways I have them get in contact with me if they want to learn more. It sends out this every week. These are the autoresponders. These are a series of automatic emails. Once again, I have a link here. If you want to go to MailChimp, they can explain how to do the video. I have different tips, for example, on heel pain, on diabetes, on wound healing, and I take all these tips. And sometimes what I do actually is I take the best blogs I have and I actually put these in these autoresponders. Because what happens is when you have a blog that people like, that's it. It goes out in your newsletter and then it's gone unless they find it on the internet somewhere. So what I do with these autoresponders, I take the best ones and I actually put them in a series that they'll get on diabetes. So some of the best ones that people liked, I put them and include them and send them out to people so that they can click on it. So if you want to see the process in action, it's pretty easy. An easy way is just to go to drpelto.com, click on the link for Foot Pain Toolkit or Diabetes Toolkit, and you can see this little login. And from this login, put your name and email, and you can see how it works. Very easy. Try to find other examples as well of other websites that do it. As you go to other things, you can sign up. Very easy to sign off. That's the main key. Any newsletter, you have to have something called unsubscribe. So if you sign up just to see how it works, get the free books and get a couple of them, then you can just unsubscribe if you want. And also tell your patients that they can do that. So that's kind of the list building process. That was part 2. So once again, write down what are some of your biggest insights, what you learned here about this list building process, who you want to communicate this, who you want to delegate this to, and then what your first action is to do this. So what's next? We've covered this in the amount of time allotted. Actually, we have a little time for questions for the actual one I'm going to be doing. If you found this valuable, you may find some of these other topics valuable as well in the future. For example, we could talk about how to make YouTube videos for patients. Very easy to do with both patient testimonials and educational information. How to do slide shares, creating presentations and what we call, you probably heard of webinars. Very easy to do with SlideShare. And also, kind of my baby these days, I'm very excited about patient treatment room presentations. You can click this link as well. And these are how to create presentations to show patients, to explain common diagnoses. That's kind of my baby these days, and I'll explain why. What happens is when I'm explaining things over and over, I find in the past doctors, we used to use just our words, making visual illustrations in patients' minds as we explain things. Sometimes we had I can use a foot model or things like that to explain things. But in this day and age, we can use the internet. We can use presentations. We have computers in every treatment room. If not, you have an iPad. And what I use these patient treatment room presentations for is I actually make a presentation on the 10 most common diagnoses that I see in the office, and I make these presentations, and I can open them up, and it goes over exactly how I treat things. So it explains everything to the patient, how I treat them, and I can have access to this in my treatment room, on my phone, on my iPad, anywhere I'm at. I can email it to anyone at any time, and I don't charge for it. And it's really providing value to patients. Let's see if I can open this up and kind of show how this works here. So if you click the link, you'll be able to see the patient presentations here. There's a lot of different types. I don't think it's going to show it exactly on this one at this time. But you can click on it, and I would really highly recommend you go in there to learn how these work. So those are things I'd like to share with you in the next series if you're interested in learning more. As well, learning more, I think we learn more together. And this was just me talking. We'll have a time for a little bit of questions here at the end. But if you're interested in going deeper with these topics, please email me at don@worcesterfootcare.com. I like to develop from this an actual kind of an office or a doctor or office manager, anyone that's interested in these topics, a mastermind. What a mastermind is people kind of working together to help each other with their businesses and kind of to learn together. So if you'd be interested in that, please email me if you found this beneficial. So thank you so much. Once again, I look forward to speaking to you again in the future.